Hello, I'm Kevin Plancher, and my charge today is to share with you at this JBJS MRC course sports and specifically shoulder. The sternoclavicular joint plays an important role in the shoulder, and you must distinguish between joint injury and physeal fractures. Remember that the epiphysis ossifies at age 18, while the physis closes even later at age 23 to 25. When talking about the sternoclavicular joint, it's important, like the AC joint, to remember that its primary stabilizer and most important part is the posterior capsule and its ligaments. It's important when you think of your patients, if there's laxity of the rotator interval, think of increased inferior translation. Think of a patient with multidirectional instability. On the other hand, if you have contracture of the rotator interval, think of a decreased range of motion or a patient that shows the symptoms of adhesive capsulitis. The brachial plexus is an important structure, and I'd just like to highlight a few of the nerves that are talked about more often than not in a recertification course. Here you can remember that the axillary nerve is off the posterior cord. It's posterior to the axillary artery, and that's why it's not affected as much in a traumatic knife wound. There is an anterior division that innervates deep to the deltoid, the anterior, the middle, and the posterior deltoid rarely. And remember clinically when doing a mini open rotator cuff tear with your lateral incision that the evidence has shown that from 3 to 6 centimeters at the lateral acromion to be cautious, as you might find that branch of the axillary nerve. Whether you do a beach chair position or a lateral decubitus position, it's important to understand in the beach chair position to know the cerebral perfusion may be decreased in this position. And open procedures are very easily converted in the beach chair position. If you're a fan of the lateral decubitus position, just recall that 35 to 45 degrees of abduction with 15 degrees of forward flexion can avoid any type of brachial plexus injury. Always protect the peroneal nerve on the lower leg and do it yourself. And remember to place the axillary roll for safety. Technical errors can be avoided if you place your anchors not on the medial scapular neck, but replace them as the bumper, as you can see here has been the problem. And recurrence can occur with anterior instability, and its most common complication is dislocation related to age. Less than 20 years of age and non-operative treatment will have a recurrence rate of about 90%. Operative intervention, when done, we have to be careful to avoid a subscapularis tear, and so we're careful to put it back in an open Bankart procedure, but can be detected by the patient with a lift-off procedure. And as said as before, here on the right, look at careful anchor placement on the bumper, not perhaps on the medial scapular neck. The rotator cuff can be torn. It is age dependent. Trauma affects a rotator cuff in a less than 40-year-old. And more often than not, it is non-traumatic in a greater than 60-year-old. The patient will present with pain or perhaps a chronic ache. They may demonstrate a sleep disturbance. They may say it's difficult to do overhead activities. And I would like you to remember the special category patients, the overhead worker that can have a very common rotator cuff tear, or the unfortunate spinal cord injury patient that has overuse from using the wheelchair and demonstrates a rotator cuff tear that truly needs this fix to get around in activities of daily living. Lastly, the little leaguer shoulder. Epiphysiolysis of the proximal humeral physis is an overuse condition. It's due to maximum pitching count. Its pain pattern occurs in deceleration and late cocking during phases of throwing. What's important is you can see here on imaging on X-ray the widening physis, the edema at the physis at the hypertrophic zone if an MRI is done. The treatment is no throwing for 2 to 3 months. The complications, if not, are physeal fracture or growth arrest. The difficulty with this entity is convincing the parents, the grandparents, the aunts, the uncles that the young child has to cease throwing as he is the star on the overhead throwing team. But I encourage you to have them stop throwing so the rest of his life he never has, or her life, any problems and complications from little leaguer shoulder.